And I think I'm a very focused individual. So much so that when I have something in my mind, I normally just kind of, I'm like a horse with two blinders on, and I will keep going until I get it. So I think that's the key thing about it. If I've set my mind to doing something, I do not give up.
Welcome to the Lim Ren En Live, and today we have a special guest, Dr. Adrian Yong.
Thank you. Thanks, sir.
Yes, it is a privilege to have Dr. Yong here, Dr. Adrian Yong. Dr. Adrian Yong is a dermatologist and also a dermatologist surgeon. There's not many dermatologist surgeons in Malaysia. In other words, he is a skin specialist. Adrian did his medical studies and training in UK, and however, he has decided to take a decision to come home and serve his country and his family. And today, Dr. Adrian is a resident doctor for AY Skin Specialist Clinic and specializes in skin disease and aesthetic medicine. So today, Dr. Yong will discuss in length with us his success in life and the secret of aesthetic medicine, bringing out the beauty in you. So let's welcome Dr. Adrian Yong. Thank you so much, sir, for coming to the show.
Thank you.
You know, it is a privilege. I knew you from a very different circumstances, right? I got to know you when one of my cousins had a skin problem and he came and see you. And I was figuring out how to write the medical report. And I came and saw you, right?
Yes.
And that was done. You helped us a lot in getting the medical report done. Thank you so much. That's how we met.
Yes.
And we got to know each other better, and things just roll on from there. And it's such a privilege to have you here. So, Adrian, tell us a bit of your background and where are you from?
Okay. I'm originally from Seremban, but I was born in University Malaya in PJ because my dad was then a medical officer working in the hospital. Before he then decided to move back to Seremban to start his own private practice at the time. Yeah.
So you were saying your father is a doctor in UM, then moved to private practice in Seremban. So your father is a medical doctor. Now, in your early childhood, I'm sure that you have seen your father work with patients and work the clinics. How did your father inspire you?
Yes. So the first thing actually, the first way I knew my dad was a little bit ironic. It was not that, I was sitting next to him, like how I am sitting next to you, and that the patient was in front of him, and I saw how good a doctor he was. How I found out how good a doctor he was at school. Oh, you're Dr. Yong's son. Oh, on the street, it's like, I've got a problem now, I need to go and see Dr. Yong. So I felt that, he made such a big difference in Seremban, that his name was well known on the streets, and he was making a big difference. But as his son, I rarely saw him. I always heard his name much more than I saw him. Yeah. But that really inspired me, that he dedicated his whole life to treating his patients, even late at night, 9, 10 p.m. after he's closed his clinic doors. Sometimes you get a call from a patient who says that their mom is very ill and they're living in a small district in Rembau, and they'll say, can you come over for a house call? And he will go straight there. The supper in his car, he was about to bring it home to feed us, but he said, just wait for another half an hour. He drove to Rembau. Yeah? So he did it out of love and out of passion, out of care, concern for his patients. And that really inspired me as a young boy.
I'm sure that you are so proud of father, right? You try to emulate his life and become as best a doctor you can. And he has helped so many people in the town of Seremban. Where is his clinic actually?
Oh, actually it's in Jalan Tuanku, Munawai. And it's been for the last 15, 20 years. Yong Specialist Clinic. Yeah. So it's been there for many, many years. Yeah.
So your father is also a specialist?
Yes. He was a gastro specialist, but in those days, there was no specific, sort of specialization courses in Malaysia. So it was more of an apprentice where you would learn the ropes, and then you start doing the procedures slowly. But time has changed, and now there are very structured programs to specifically specialize in certain medical specialties. And you have to enter the courses to be able to be trained and fully get a stamp at the end.
Mm-hmm. So why didn't you go actually and become a gastro, but then you decided to do skin?
Yes. So everyone's journey is different, and my journey was different. A lot of the influence that I had was when I was, because I spent time overseas in the UK, right? I grew up as a boy in Seremban, but I then went to Singapore. I was living in a boarding school all by myself for 4 years under the ASEAN scholarship. And then from there, I applied to the UK to do medicine. And when I got in, I wanted to chart my own path. I wanted to have an identity and not be just like my dad. Secretly inside, I would have always felt that I want to be version 2 of my dad, which is a better and more successful doctor than he is. So, not that a dermatologist is more successful than a gastroenterologist, but I would say that, my main interest when I got into university was that in, making sure that people had the confidence to be able to do what they want in life. And a few experiences when I was there, including a fellow classmate who almost dropped out of medicine because they had very, very severe acne with scarring, and they were getting depressed, and a simple tablet and a visit to the dermatologist managed to change their life around. And they then succeeded and became one of the distinction students. And that was my first thing, that there are a lot of people who just say, look, skincare is just superficial, it's not important. But there are a lot of people out there who are suffering incredibly, both physically and mentally. And even until today, I'm very proud to say that there are patients who come to me and they come in crying and they leave smiling and laughing. And I think that really makes it worth the while.
Now, you're saying that, that is quite an amazing story, right? You came from the small town of Seremban and you went to Singapore under the ASEAN scholarship, which is the smartest of Malaysian actually only can apply right now. And from there, you're boarding school, and then you went to UK. If you look at yourself from your young age, right to boarding school and right to doing medicine in UK, what is that thing that make you so successful in what you do in every stage of life?
Yes, I think the key ingredient here is focus. And I think I'm a very focused individual. So much so that when I have something in my mind, I normally just I'm like a horse with 2 blinders on, and I will keep going until I get it. So I think that's the key thing about it. If I've set my mind to doing something, I do not give up.
Mm-hmm. So meaning from young, you knew that you want to be a doctor, just like your father.
Yes.
But when you're in UK, you decided that you want to do skin.
Yes, correct.
Yeah.
I actually explored a lot of the different options. I even explored cardiology, I explored plastic surgery, I explored radiology. But in the end, the people who inspired me the most and the experiences that I had were all skin related. And and that's how I got into it.
So how many years were you in UK?
Okay, so from the time I went, I was 17. And by the time I left, I was 35.
Full scholarship?
Well, the first part, of course, in Singapore was full scholarship. In the second part in university, my dad helped me a lot.
All right.
Okay, and it's a debt that I'm trying to pay back, but I don't think, at his stage, money is a concern. It's more to do with the image. I think it's more to do with what has become of me, what I can contribute to society, and what I can match. So what he contributed to Seremban, I'm hoping that I can contribute to the whole Klang Valley. And
Fantastic.
This is an improvement of what he is.
That is wonderful, It is about serving, not taking, giving and not just taking, right? I think that attitude makes you who you are today. And your clinic, Dr. Adrian Yong's clinic is at Damansara, Uptown Damansara.
That's right, yeah.
Just right opposite Starling Mall. Mm-hmm. Right, it is quite visible. Later we'll show you where the clinic is and you'll be able to find him. Now tell us, you spent actually close to 18 years in UK and you had a family then.
Right.
You were married. Yes. Your wife is also a super achiever. Right? His wife is a super achiever. Your wife is a international banker.
Yes.
She was working with some really great banks. But you guys decided to come back to Malaysia. Why?
Okay, two main things. Her dad is alone now. Unfortunately, her mum passed away when she was young. And a lot of her siblings have already emigrated. And we felt that, you know, for our parents to have sacrificed so much and to have paved the way for us to achieve our dreams, I think the least we could do is to come back and be able to be around in times of need. And I think that was one of the main things that we were considering, the main factor. The second thing, of course, is you can't take the Malaysian out of me. Even after many years, my diet, my habits were all very Malaysian. Still want to drive everywhere. I still want to eat Malaysian food. I was the only one who would be microwaving sandwiches in the hospital queue. And 2 steps behind me was my other Pakistani consultant, who was also microwaving sandwiches. Because we can't take cold sandwiches in our stomach. You see, so we need hot food, good food everywhere. So I think that's the second thing. And of course, the third thing is when I managed to specialize in dermatology there, when the blinders was off the sides of my eyes, and I looked around and I thought, okay, I've reached a stop here. Where should I go next? And I looked at my options and I thought the ratios of the number of skin specialists in Malaysia, population is about 30 over million. There's about 100 specialists only.
There is only 100 skin guys
in the whole Malaysia, who is national specialist registered.
Okay, those are like dermatologists plus dermatologist surgeon.
Dermatologists only.
Oh, okay.
So, whereas in the UK, you're talking about a population, of course, larger, but their consultant numbers are about 500 or 600. So, in any single hospital, you have about 7 or 8 consultants, even in every single city you're talking about. All the football cities you can name, there'll be at least 7 or 8 consultants there. In Malaysia, most states will have only 1 consultant. Sometimes 1 consultant serves 3 or 4 states.
We are we are not underserved by doctors, but we are underserved by certain specialty.
Correct.
Certain specialty.
Yes.
It's just like the vascular guys. There's only 26 of them in the whole nation. But the vascular guys does all the diabetic food, all the pots and all that, chemo pots and all that. So that is the thing. So as a derm surgeon, your job is not just to see skin problem, right?
Correct. Yes.
So tell us, what does a dermatologist surgeon does?
Okay. Now, my main bulk of work when I was in the UK was skin cancer surgery. So, but of course, skin cancer is not as prevalent in Malaysia as it was in the UK. I'm talking about something like 10 to 15 cases of excisions or removals per day of skin cancers. And even at that rate, as a trainee, as a consultant, we were not able to clear the backlog because there were that many skin cancers. Okay. Now, my main task when I come back is basically acne cysts, boils, and then pus areas because of our weather. It's very hot, it's very humid. A lot of those conditions, boils occurring on the face, on the armpits, and so on. So that's the main bulk of work. The second bulk of work is that of scars, keloids, which are overgrowing on the chest, on the arms, on the back of ears. Yeah, and that is where it's a very, very nice position to be in, where we can play with lasers because I love technology, and combine, scalpel, the appropriate use of that, and lasers to give patient the best. And when I first came back to Malaysia, I had big dreams in setting up all these things in University Malaya. Okay, but there are limitations to what we can have as in terms of funding, in terms of setup, and in terms of job scope. And I think that was the main thing that I felt that, as I've mentioned before, that once I have the blinders on, I'm very focused at what I want. I want to be able to practice dermatology at its best. And the only way I could find that is not even in a hospital. It's only in my own practice, where I can define exactly what the parameters are.
That's why when I visit your clinic, it doesn't feel like a Malaysian typical clinic that you find anywhere. Your clinic feels like you're in London. It's different. There's a slope going up to the clinic, you know. The doors, of course, is bigger. That's the clinic standard.
Yes.
But the aesthetic and everything is very different. It's different, you know. I think you set it up purposely that way, right?
Yes. I think the priority that I always had is accessibility. And I want to be able to cater not to just people who are concerned about their looks, but also people who may be in nursing homes, people who may not, you know, from the early days I mentioned that my dad used to do house calls, right? That I want them to be able to access it via wheelchair. So we have parking right in front of the clinic. I actually chose that spot so that we can have our own private space, so that if they booked an appointment, they can actually come in through that access door.
Yeah.
Yeah.
So you choose to have a clinic in Uptown Damansarang, but at a bungalow, I think.
Yes.
It is a bungalow, so that's why he has a private parking. It is quite easy to actually go to his clinic. Basically, I always park in front of the clinic. There's always spaces. Sometimes there's no spaces. There's too many patients. But anyway, most of the time they are, right? And it's just a walk away from Starling Mall, so it's very, very easy to access. And I love that slope, you know, that wheelchair slope to your clinic. That actually brings a lot of thinking into actually setting that up. Nice job, you know, very nicely done.